Thank you, everybody, for attending. I just want to welcome the electeds that are here today, including Senator Stavisky, Assemblymember Cruz, and Senator Ramos. Thank you very much for coming.
Hey, I want to thank Doctors Council for bringing us all together, and for their President Frank for starting us off, and Kevin Collins for all his work in putting this event together. But it's really, today's event is about our doctors, and thanking our doctors for the amazing work that they do every day, but especially this past year. I don't need to tell anyone what a horrible year this has been, how much we've lost, the people who we worked with side by side, who we lost in this horrible pandemic, and how brave our entire staff were, our doctors, our nurses, our pharmacists, all of our staff, our environmental service people. But again, today is about remembering our doctors who walked into rooms knowing that they would be putting themselves at risk. They intubated patients knowing that the risks are particularly high in procedures like intubation or other invasive procedures, but they always put their patients first. They always took care of the patients no matter what risks they were putting themselves in. Many of our doctors stayed in hotels for fears of infecting their family members. They were isolated at exactly the hardest time. We all saw death in a way that as doctors we never anticipated in terms of the volume. All of us who went into medicine and became doctors understood that sometimes we would lose a patient. I think we also understood that sometimes our profession would put us at risk. But I don't think any of us before COVID understood how great that could be, what it could mean to not lose a patient in a week or a month, but to lose many patients on an evening due to a horrible disease for which at the beginning we had almost no effective treatments. And I know that there's still a lot of people who are very seriously traumatized by that. I know I still wake up in the middle of the night sometimes thinking about things I wish I had done different or better, or could we have done something different to save more lives. And while I think that kind of thinking is understandable, I hope that everybody here, everybody in health and hospitals, everybody in our broader medical community understands we saved lives. We saved lives. The vast majority of people, even in the darkest day, left the hospital alive. And had it not been for us intubating them, oxygenating them, taking care of them, putting them on medicines, they wouldn't have. And some of them left after a few days, some of them left after a few months. But we saved their lives, and to this day, we do that. So in closing, I want to say I'm very proud to be the president and CEO of Health and Hospitals. I do my best to run Health and Hospitals the way I think a primary care doctor should run a hospital institution, which is to say that I always think of us the way I think of every patient I see in my exam room. What does this person need? How can I best reach out to them? How can I best connect with them? And I know that that's what great doctors do every day. And I thank all of you for your contributions, and especially for being part of Health and Hospitals. Thank you.
Thank you very much, Dr. Katz. I want to just say good afternoon to everyone again. It's great to see the community here, the electeds, the doctors, the nurses, and the rest of the staff. Thank you very much. I'm Dr. Frank Proscia, President of Doctors Council SEIU, the union that represents employed physicians, thousands of which are across the nation, and here in New York City, including New York City Health and Hospitals, Elmhurst, and the entire system, the mayoral agencies, and more. When COVID-19 first hit New York City, about a year ago this month, Doctors Council SEIU created a hotline so that members could call text, or email us. In the half century that Doctors Council SEIU has been around, we've never experienced anything like this. We had doctors calling, telling us that they had contacted their families, saying that they were going to be away for weeks or months, maybe staying in hotels or motels so that they wouldn't affect their families. This was a pretense because they knew they may very well succumb to the virus, and many of which employees of New York City Health and Hospitals joined many in the city that did pass. We had family members even call us up, and you could feel and hear them sobbing on the phone, and it was palpable, the fear that they were going through. Doctors were being sprayed upon, as Dr. Katz mentioned, as they were intubating patients that had COVID-19. They were dealing with lack of PPE, short supply of space, beds, machines, medications, all throughout the city, and it was a difficult time. There were doctor moms that had newborns that were attempting to get to work using childcare, but at the peak of the epidemic, of the pandemic, none was able to be found. Now, 1 year after, there have been a great toll on the city. 30,000 New Yorkers have passed, 53, as I said, employees of New York City Health and Hospitals, and nearly or about 800,000 have been infected. We thank all the members of the patients' care teams, doctors, nurses, PAs, residents, techs, housekeeping, everyone that unified and they fought together to fight this pandemic. I'm so grateful for each and every one of you being here today to say thank you and to honor the doctors across the New York City Health and Hospital system. We call on everyone to honor doctors by continuing to wear masks, wash your hands, social distance, and vaccinate, because this will help us not get infected and spread the disease and potentially have people die. We call on New York State's executive branch and legislature to honor doctors by not cutting the budget for health care that's due on April 1st. Especially not to cut funding for New York City Health and Hospitals, the public safety net for the entire city. Cutting funds during a pandemic is unbelievable, to say the least. We call on each other to honor our doctors by calling out, condemning, and stopping discrimination and racism, especially the recent attacks on the Asian community. We must ensure that communities of color that were disproportionately impaired by COVID get what they deserve, the resources and equitable vaccinations. We call on the federal, state, and local governments to honor doctors and continue funding New York City Health and Hospitals to enable the retention of these doctors and the recruitment of future ones. We must have enough doctors to ensure safe staffing for patients and the access and care of services. You need to fund mental health services, as Dr. Katz had mentioned. These doctors are not the same ones that started out a year ago. They've been changed by what each and every one of them went through. And it's probably never going to heal completely. Doctors Council, SEIU, represents frontline doctors, and we know the devastation COVID has affected this city, the patients, and the communities. As doctors, we took care of too many patients that were infected, too many patients that passed. We saw what it did to our colleagues. We saw them getting ill and some perishing. These essential workers, all of them, put their lives on the line each and every day, and they should be commended for that. These people are examples that this city will get through this one way or another. We will get through it. On March 30th, each year is National Doctors Day, to honor doctors, these professionals, for their dedication and their service to society. The doctor's dedication puts the patients first time and again. On National Doctors Day, we say thank you to our doctors for all that they do each and every day. That is why Doctors Council SCIU wants to take this opportunity to say thank you to each of you, seriously, from the bottom of my heart, for everything that you've done and everything that you continue to do. And you put patients and the communities first beyond yourselves. And I want each and every one of you to take this as an opportunity to give them a round of applause and to say thank you, doctors.
Dr. Katz, thank you, and Dr. Proscia and Mr. Collins, and especially to the folks at Elmhurst Hospital, Helen Ortega Landaverde. We don't have to welcome you. This is our community. You've been here for so many years, and it's great to see that local talent has been recognized. And to your more than 4,000 employees who work together to provide such wonderful health care. You mentioned the budget, and I do want to say that I chair the Committee on Higher Education. And in the higher ed budget proposal is a $4 million grant to CUNY and a $4 million grant to SUNY for mental health services. Hopefully it will stay in. And interestingly, this proposal came from the students at hearings. The students, the chancellor called me last night and said, how's the mental health, Chancellor from CUNY, how's the mental health appropriation? Let us hope it remains in the budget. It's being negotiated as we speak. My guess is that we will have a budget next week, and hopefully the restorations will be not restored, but enhanced so that you can do your job. I think what's unique about Elmhurst Hospital is that everybody comes here. You don't care what they look like, the language they speak, where they came from, whether they have papers or not. Everybody comes here. I've been here many times, as you know, and I marvel. And last year, when the staff stood outside and we celebrated the fact that they were working so hard, and they used to call Queens the epicenter of the COVID crisis. Elmhurst Hospital was the epicenter of the crisis. And amazing things have happened here, without a doubt. But I want to thank Dr. Proscia and the Doctors Council for not only treating patients, but advocating for them, talking about the issues, safe staffing, without a doubt. And I'm a co-sponsor of the legislation. The care that people receive. The patients do need an advocate, and the Doctors Council has been there for so many years for the patients, speaking for them, and as well as workplace issues and other issues that you don't expect doctors to speak out on. But this is such a unique combination of labor and management and issues. And we appreciate, as we said, everything that we do, that you do, and let us hope that your job gets easier and that people do get the vaccinations and that they do we're socially distant, wiping the microphones, and together I think we can all say thank you to the doctors.
Thank you. And I'm also a proud patient. I don't know how you did it. You were trained to save lives. You were trained to help our community. But what we went through last year, I have absolutely no clue how you did it. And for that, we are eternally grateful. For that, we are in awe. You know, we always talk about the superheroes that you see on TV, the kinds of things we grew up watching as children, but the idea that many of you couldn't hug your children, couldn't kiss your loved ones, lost people that you cared about. The idea that many of you had to watch as others died and there was not a single thing you could do. And you still found the strength to fight back, to be there, to do it. On a personal note, many of the doctors here now know this, but almost all my family got COVID. My mom was here in the emergency room, and it was your doctors who saved her. It was your doctors when I came in that gave me hope that she was going to be okay. And so when I think of what you did for me, and I think of what you've done for thousands of families, as Toby said, regardless of your status, regardless of whether you had papers, spoke the language, did not speak the language, looked like them, you saved as many as you could. And on behalf of those families, thank you. And it isn't enough to just say thank you, and I thank you for clapping, but it isn't enough to just say that. If you're really thankful to our doctors, to our nurses, to our hospital, wear your mask. Keep your distance. Get vaccinated. Dismantle all the lies that you see on social media about what a vaccination really does or is. Because until we do that, you're not thanking anyone. You're perpetuating what ended the lives of thousands of people in our community. Next week, we're going to go to Albany, and we're going to make sure that those proposed $20 million that are proposed to be cut from our hospital don't happen, because you deserve better than that. I want to thank the Doctors Council for being an ally ever since the first day I stepped into the assembly, for being an ally to the many people in our community who need it, because as Toby again said, it wasn't just the doctors you've been advocating for the patients, the nurses, and everyone that is your support system. La próxima semana tenemos un presupuesto que quiere quitarle $20 millones a nuestro hospital y no lo vamos a permitir. Porque en este hospital, al igual que se hizo con mi familia, con mi madre, cuando terminó aquí en la emergencia con COVID, como lo hicieron con mi familia, lo hicieron con miles de otras familias y lucharon. Y muchos de ustedes no pudieron ir a su casa, a abrazar a sus seres queridos, a darle un beso a su hijo, a leerle ese cuento en la noche. No lo pudieron hacer por mucho tiempo porque estuvieron aquí salvándole la vida a nuestros vecinos. Y por eso les damos las gracias. Y la mejor forma de agradecer todo su sacrificio es vacunándonos, manteniendo nuestra distancia, cubriendo nuestra boca, porque no es suficiente salir a las 7 de la noche y aplaudir. Enough of that. 7 o'clock, we go out and we clap. That's over with. Now, we have to do more. And we are eternally grateful. And we're going to be here for you, because we are not going to let our hospital be anything but the best community hospital in Queens. Thank you. Oh, and big shout out to my girl, Helen.
Hi, good afternoon, everybody. You know, it's always a pleasure to be at Elmhurst Hospital. Thank you, Toby Stavisky, for letting me cross 41st Avenue to be here. I always remind people I was born here. Elmhurst Hospital means a great deal to me, to my family. And there's nothing like Doctor's Day, I guess, to put everything into perspective. You've all heard how much we idolize your sacrifices, your steadfast determination to keep our community safe and healthy. But I also think Doctor's Day should be a day of reflection, and for us to look at past practices and see how we can learn our lessons moving forward. I think, especially for those who are those of us who are legislators and write policy and think about how we vote on these measures every day. Certainly the budget is important, but really We miss the mark when we don't allow public health experts to lead public health crises. And unfortunately, all the way from the top, epidemiologists have not been heard in our state government as they should. And I'm here to say that we need to figure out how to do better in that respect. If we truly believe in science and are asking people to get vaccines, to get tested regularly, to do all of these things to keep each other safe, well then it should be our public health experts who put forth what our pandemic responses should be. It shouldn't be led by politicians. It should be led by our experts. That's why we have them. And that's why I hear your calls for safe staffing. I've heard them for years now. And if the pandemic has taught us anything, it's that we have to listen to you and the New York State Nurses Association when we're told that we need a better staff to patient ratio, that we need more hospital beds. It's not lost on us that we've closed 5 hospitals in Queens over the past 20 years. We all remember Parkway Hospital, right? We all remember St. John's. It's a damn shame that here in Queens, the most diverse corner of the country, where we all show everybody else how much we care about each other, we don't put our money where our mouth is. So that's going to have to change, especially as we continue to push for the New York Health Act, because that's really what we need. We need every single New Yorker to have guaranteed high quality health care in New York State. Yes, no matter immigration status, no matter where you come from, no matter what you speak, but no matter what you're going through, no matter what your pre-existing conditions are, no matter what your life experience is, no matter if you're a sex worker on Roosevelt Avenue or a finance guy on Wall Street, it doesn't matter. Everybody should have access to the same quality health care. Para mí este Día de los Doctores significa un reenfoque sobre las políticas que hemos estado pensando en respuesta a la pandemia en los últimos meses. Es muy desafortunado ver que muchos de los expertos se han quedado por fuera de los lugares en donde se han discutido y hemos arribado a las políticas que nos han llevado a este momento en donde hemos perdido tantos de nuestros seres queridos. Así que mucho más allá de celebrar a los doctores, quiero asegurarnos de que también estemos hablando de garantizarle a cada neoyorquino cuidado médico de alta calidad, no solamente sin importar su estatus migratorio, pero también sin importar su experiencia de vida, lo que haga de profesión. Aquí la idea es que necesitamos prevenir más crisis de salud pública. Y desafortunadamente hasta ahora hemos visto que la respuesta no ha venido de los expertos. Así que eso es algo que de verdad insto al gobernador y a su administración a que cambiemos. I want to thank the doctors, gracias doctores, for everything you do, and for keeping us healthy today and always. Thank you.
Hello everyone, good afternoon. Buenas tardes a todos. I just wanted to say, I want to thank the Doctors Council for making this beautiful event happen here in our beautiful Elmhurst Hospital. What a better place to celebrate than here. I'm a little biased though, so forgive that. But I just wanted to tell you the other day, I was doing a CEO round and I saw a group of residents and they were hovering over like a computer. I don't know what body part they were seeing. I was in the CCU, so probably the heart or something. And I just saw so much excitement. They just had like an aha moment. And as a CEO, I was very proud because I was like, wow, we are creating confident, strong providers for our future. And then for the next second, I thought of myself as the patient. And I was like, wow, as a patient, I was full of gratitude because that aha moment, that spark that those residents had transferred over to the attendings. And the attendings then had an aha moment, which then gave their aha moment to me. That meant I could breathe better. They figured out what was wrong with me. Or that just meant I got to go home a day earlier to my family. So those sparks just made my day. Watching that, I was like, wow, this is what making doctors of the future mean. And I was just so proud of our hospital. And at the same time, I also know that spark is hard. I know that spark costs time, a lot of sleepless nights. I know you guys don't sleep, I also know you're here 24/7. I know you're here when we need to call you. You never say no. And I know it's because of that spark where you figured something out, not for yourselves, but for others. And that selfless spark, I'm just so proud to be your CEO. That's what makes this my dream job. And then I also want to thank you on behalf of the 100,000 plus people that walk through our doors, both inpatient and outpatient, because you see us. And that's hard to do, but that's also because of that spark that all of you have. That spark, you see me because of my language, you see me because of my culture, you see me because of what I believe. And I don't know if you know this, but we speak over 138 languages in these walls. And you do that with respect. And today, on this beautiful day where the sun is coming out, and spring is here, and there's hope, and we have the vaccine, I just want to say gracias. Thank you. You guys deserve more than just this day, but know that you have my full gratitude, and I will work as hard as I can to make you guys even more prouder of those little sparks you get every day. Thank you.
Hello, Elmhurst. It is in fact my birthday. Thank you, thank you. I'm Dr. Susie Bentley. I'm an emergency medicine physician here at Elmhurst. I'm the medical director of our simulation program and a leader of Helping Healers Heal for Workforce Wellness. I'm a proud member of Doctors Council. I've been a doctor for 14 years. I was residency trained here at Elmhurst and at Mount Sinai, and I've worked here ever since. I've been here for over 10 years. So happy National Doctors Day. Can we get another round of applause for our doctors? It is really, truly so great to see humans in person, in public, coming together. It's really a major sign and a reminder of hope and life moving forward from the worst of COVID. Although we know, and as we've heard, we need to keep our masks on and our guards up. It's an honor to have this special event commemorating National Doctors Day held here at Elmhurst today. There is nowhere more national and international than Elmhurst, with an amazing community, as we've heard, both within the hospital and within our healthcare worker community itself, reflective of so much beautiful diversity. I am so proud to work in a health system that cares for all patients, no matter who you are or where you're from. I'm honored to have been asked to offer some reflections, and I'd like to start by thanking all of our doctors again, and also thanking all of you, all of those who support us day in and day out. Thank you to Dr. Katz and the Health and Hospitals team. Thank you to Dr. Mashapur, to Helen, to our incredible Elmhurst leadership team, and to Dr. Proscia and the Doctors Council, who I'm honored to represent today. And truly, thank you to all of the members of our amazing healthcare teams. Our nurses, our clerks, our techs, pharmacy, transport, that list goes on and on and on. We are one team, and without any member of that team, we wouldn't be able to provide the exemplary care that we do. It's a particularly bittersweet Doctors' Day this year as we reflect on the realities of the last year of the COVID pandemic. It's truly hard to believe how much has changed since we were last together on Doctors' Day. Quickly hitting the map as the epicenter of the COVID crisis, never before have we ever been so tested, as doctors, as healthcare workers, and as human beings. We were all pushed to the breaking point, but we did not break. We showed up. We showed up for each other, for our patients, and for our community. We were scared, we were tired, and we often felt helpless from the mounting uncertainty, but we showed up and we came together. We weathered this storm together as a team, better for every member of that team because we relied on each other to care for our patients and to care for each other. We lost patients. We lost so many patients. And we lost family members from our own families and from our work families here at Elmhurst and across health and hospitals. And we lost many friends. But you know what? We never lost hope. As doctors on the front line, Elmhurst became our home away from home more than ever. We spent so much time here and so many hours here throughout the pandemic. As we heard, this was the epicenter, a true battlefield of the pandemic. The ER was perpetually packed, and not normal packed, like pre-pandemic, really, truly packed. Sirens were heard 24/7, and I'm sure you've all seen our streets or seen in the media the lines of waiting ambulances that stretched for as far as the eye could see. If you walk through our ER or anywhere in our hospital, you saw a sea of healthcare warriors, all in masks, surgical caps, goggles, face shields, gowns, gloves. That was our armor. But our biggest weapon, in addition to our medical expertise, was our dedication, our grit, and our heart. We were beyond packed, seemingly working around the clock and against all odds, meeting whatever challenges as they arose, keeping up with the ever-changing information and guidelines about the virus, and seemingly running nonstop, even when it felt like we were never able to get ahead of the tidal wave that was COVID's arrival in New York City. We were scared for our lives, for our patients, and for our city, but we never ran out of heart, and we never ran out of hope. And you know what? We never stopped trying harder than our hardest on the worst days. We came together. We came together to maintain the fight against COVID for our patients and to bear witness to our shared experiences and to the grief and the loss that defines the COVID-19 pandemic. It was often messy and painful, but the heroic vulnerability and the beautiful stories of perseverance will never be forgotten. We will never forget what we've been through and what we've been through together. Many of us are not okay, whatever okay even means, and we won't be for some time to come. And that should be expected and supported, because that is okay, because that is reality. But we are strong and we are healing as individuals and collectively. We learn so much. We learn to lean on each other. We learn to accept help. And we came together in ways no one would have ever imagined before COVID started. The pandemic is not over, and for many, the grief and the grappling is still very much present. So I implore everyone, our doctors, all of our healthcare workers, and the public alike, to please continue to feel your very real feelings with permission to not always have to be okay. To please know you're not alone if you're struggling. And I implore you all to please continue to look out for each other, to lean on each other, to lean on helping healers heal, and to get the professional mental health support that so many will need as we move forward from COVID. As the case rates are declining, the vaccination rates are climbing, and even the weather feels more optimistic. Let's look together towards the future that is so, so bright. Quite often I'm reminded of a favorite quote. If you ever think you can't handle something, think of what you've already done. Doctors, colleagues, and friends, on this celebratory National Doctors Day and every day, let us never, ever forget what we have already done better because we were in it together. I thank you all for your service and dedication, for showing up day in and day out through the pandemic, and for being so, so strong. We remain in this together because we are Elmhurst strong, we are Health and Hospitals strong, and we are Doctors Council strong. Happy Doctors Day to my fellow doctors and to all of the amazing people who support us. I'm honored to stand with you today and every day. Thank you.
It's such a privilege and honor to be here with the frontline heroes at Elmhurst today. Thank you, Helen. I love how the sun came out as soon as you took stage. Thank you, Dr. Proscia. Thank you, Dr. Katz. And on behalf of Queensborough President Donovan Richards, we're here to celebrate National Doctors Day, which has a special meaning this year because of what we've been through. We owe a huge debt of gratitude to the doctors who have and continue to give so much of themselves to the well-being of everyone in Queens, and especially this past year as you've cared for patients who had COVID-19. The great work of Elmhurst staff attending COVID-19 patients, along with their skill and dedication in truly addressing other health concerns, is inspirational and worth acknowledging, celebrating not only today, but every day. We owe a huge debt of gratitude to the doctors who have and continue to give so much of yourselves. And I have to say that I think about what you probably went through as you're studying to become a doctor and giving your Hippocratic oath. I can't imagine that you actually imagined that this would happen over this past year. But you were there when we needed you the most. And thank you for leading us and leading Queens. And a lot of people over the past year decided, as we were experiencing more and more of this rise in COVID in New York and in Queens, whether they should leave. But I knew that no matter what, we have the best health care in this city and in this borough. And I'm glad that we are here today standing with you. And I know this because my mother was in the healthcare industry. She started off as a nurse's aide and ended up as a medical office assistant. So I know how hard you doctors work firsthand, and I have to thank you for that. She was also part of SEIU. So we're going to continue to work with the Office of the President, with the governor, with the mayor, with our elected officials to make sure that we have as much as we can lobby for and bring to Queens. And we know that our chief responsibility at the Borough President's Office is to make sure that we get the resources here that we all deserve. We're doing everything to make sure that Queens gets our fair share. So please enjoy this day as we celebrate you. And we want to see a healthier Queens. So thank you for all you're doing. And we commend you on being Elmhurst Strong. Thank you.
Good afternoon. Let me first take the opportunity to thank all our elected officials for your continuous support, not only today, but through the years. You really made Elmhurst what we are today. On behalf of all the doctors, I would like to thank Dr. Katz to share his half a day with us, and also Dr. Frank Porsche and Kevin Cox. I go back to 1992 when I first met Frank Porsche as one of the practicing psychiatrists at Queens Hospital. I cannot believe through the years what Frank made out of the doctor's concept. I remember that the doctor as a collective bargaining team didn't have much voice even in the city with the mayor's office or even in the state. But today we can stay strong that we practice medicine, but they are a strong team that support your daily function. From what just I heard 2 days ago from our finance people in Health and Hospital Corporation, that $150 billion was allocated to the New York City and New York State, but a healthcare provider did not have a share of that. So I'm so glad to hear from our elected officials that they are supporting and protesting any budget cut to the city hospitals. I mean, you heard enough about our involvement during the COVID in past 1 year. I always remember that I first got a notice exactly on February 26th, an email that came to me, and I was in Grenada attending a conference, that 2 hospitals was allocated by the mayor and governor and also H&H to be receiving hospital for the COVID patient. One was Bellevue and the other was Elmhurst. Dealing with a lot of pandemic and epidemic in the past, I took that very lightly, that this is another outbreak that we have to deal, and Elmhurst team as usual always is ready for that. It came to the second week of March that I realized the intensity and the number of the patient that we receive 24/7 was beyond our capability actually to care. I called Dr. Katz, sorry for wake you up at 7 o'clock in the morning, that unless we get the help from other sources, Elmhurst would not be able to cope with such a crowd patients. I mean, at one point, Stu Kessler told me that they had 350 patients at 11:30 at night, and the ambulance were outside with the patient. We did not have wheelchair or a stretcher to unload the ambulance. That was the extent of the patient load that we received. Unfortunately, between the Navy, Army, and FEMA, and also great help that we received from Health and Hospital, from support service, we were able to cope and do our best for our community and our patient. I'm so glad to report that lots of patients walk out of the hospital, even they came to us in real bad stage of the disease. And I'm so proud to tell you that up to now, we vaccinate over 25,000 people in our hospital, and we encourage the community, friends, and family really to make sure that the best weapon that we have against the disease, as you mentioned before, vaccination, distance, hand wash, and what we have to do. So I'm so again happy and thankful to Dr. Katz and our elected official and Frank Porsche for supporting Elmhurst, when we count for your cooperation. And I think for the doctors, 365 days is Doctor's Day, but we take this day as opportunity to thank every and each of you. Thank you.
Thank you, Dr. Porsche. Thank you, Kevin Collins. Today is the day that we are to honor the doctors. My history is I'm a lifelong resident of Queens. I was born in Queens. I still live in Queens. I will probably die in Queens unless I'm on a plane going somewhere. All right. I have great memories of Elmhurst in terms of family and friends coming here through the years. I'm also a retired nurse from Bellevue Hospital after 40 years of service. So I've lived through a number of epidemics, and I've seen the importance of doctors in particular, as well as nurses working together and other healthcare members as a team. And I still do some bedside work at the Manhattan VA, and I actually saw patients at the VA coming from Elmhurst because of the overflow. And I can't tell you how much it was so important that doctors and nurses, as well as the other support systems in terms of nurses' aides, etc., came together to handle this pandemic. It also brought back memories to me because I'm old enough to tell you that I worked before AIDS. And I remember some of the poor governmental support that was given to the care of those particular patients. And I also remember wrapping a body every night because we didn't have EMTALA back then. And the public health system was where those patients were sent to. We did the best we can, but we knew that once they got intubated, 99% of the time they were going to die. So we did the best because we didn't know what was going to happen the next day in terms of what might be discovered. Why I bring this up is because we also had to advocate for needle safety products. We had cardboard boxes as doctors and nurses to cut off the needles through a needle cutter and then stick that needle in a box. And I witnessed colleagues coming down with, bloodborne diseases like hepatitis. I saw a nurse die as a result of that I worked with. Subsequently, fast forward to today, the fact that, protective personal equipment is what we all need to advocate for. And I personally, maybe very subjectively, feel that the public sector had the best supply. It didn't have adequate, but it had the best supply of personal protective equipment. And what we need to do is we need to continue to work together. Because in those needle safety products, they used to still have the flyer up there from like 30 years ago at Bellevue. We work together with Doctors Council as well as CIR in terms of helping to facilitate those needle safety products. And I know we're doing the same today in terms of personal protective equipment. So I'd like to take this moment to thank the doctors that nurses work with every day, and that both groups support the fact that we need to have safe staffing, not just safe staffing of nurses, but safe staffing of doctors, safe staffing of nurses' aides, safe staffing of social workers, etc. Because our patients, our community deserves the best. And I do believe that Health in Hospitals does the best to support the community that it serves. And it's no secret that I'm a strong advocate for that public sector, and the private sector comes second. So I wish once again, on the part of the New York State Nurses Association, to thank the doctors that we work with every day for the great care that they give our patients and the great support that they are in terms of members of the healthcare team, where we all focus on the patient, focus on the community that we serve. And thank you, Elmhurst Hospital. Thank you.
Doctors, along with many other essential workers, have put their lives on the line during this pandemic. They allowed us to shelter in place. Along with Doctors Council, we give the utmost respect and thanks to all the doctors, especially at Elmhurst Hospital and the rest of New York City Health and Hospitals. But our gratitude has gone beyond words. We must take action to improve the stressors and reduce the burnout experienced by our doctors and nurses that have naturally grown more active with COVID-19. Furthermore, we must eliminate structural racism, because that too helps patients. That too helps our doctors and our nurses. Nationally, doctors are often asked to keep their views to themselves, but we know New York is different. Our doctors talk broadly and join advocates always about the issues that impact the patient's health and their lives. I often tell folks that I am a product of public housing and public schools, but I'm also a product of public hospitals. I know very well the quality of care of our public hospital system as a 6-year-old boy, 6-year-old Puerto Riqueño with severe asthma in the emergency room and getting care. I know that as a teenager, sitting by my mom's hospital bed as lupus was taking toll on her. And then few years back, when that same lupus caused her a cardiac arrest and the hospital saved her life. A public hospital saved her life. We often think that our public hospitals, public schools, public education, public housing are inferior to the private or anything else. That is not the case. We need to say it very differently. If you look at the state budget, the Senate and Assembly took the first step in respecting the communities and respecting our doctors and nurses by rejecting or repealing major healthcare cuts, major cuts to Medicaid, major cuts to public health, major cuts to the public hospitals. But we have to do more. That is one step to make sure this enacted budget really respects and thanks the very same health professionals, advocates, and communities that have taken a toll from this pandemic. We need to understand that the governor's budget cuts is racist. If you don't believe that, think about who is getting hurting. Think about any time you do not value or care about communities of color, immigrants, and other marginalized communities, what you decide to do is take away, destroy, or cut the very same services, the very same safety nets that they deserve and they rely on. That is our public hospital system and everything else. So yes, you want to be an anti-racist, then you make this budget respect those very same communities. I stand with Doctors Council and New York State Nurses Association in many efforts in terms of the fight of the healthcare budget cuts. But we have to thank our doctors and our nurses. And you just don't say it with words. You say it with the actions in your budget. You say this in the actions of what you do in your policies and government and so on. So I'm here to thank you all for what you have done for our communities, and thank you what you've done for me as a child, and thank you what you've done for my mother for so many years. Thank you.
Well, they saved the quickest for last. Hello, everyone. I'm Jasmine Dave. I've been an attending surgeon and proud member of Doctors Council at Elmhurst for over 15 years. I've had the pleasure of knowing a ridiculous number of you for many, many years. And I've been roaming the halls of H&H for even longer. I think it's over a quarter of a century. As an NYU student at Bellevue and a surgery resident at Bellevue, and then as an attending at Elmhurst. Jackson Heights and I go back even longer. I remember the long drive from New Jersey with my newly immigrated parents as we came here to buy Indian groceries and eat at restaurants that reminded us of back home. I think these ties, cultural, academic, gastronomic, to Queens and Elmhurst are shared by many of us. We like working at this hospital that allows us to take care of our patients, irrespective of their race, their immigration status, their ability to pay. We feel good about our mission, the care we provide, and we like working with like-minded colleagues. Never would we have described ourselves as heroes. Nerds and geeks in white coats having aha moments perhaps, but not superhero capes. Well, after the past year, I can think of no other way to describe you, or I, or us. We are heroes. All the doctors across H&H are heroes. Now, you may think I'm being overly dramatic. You say heroes risk their lives saving people. Well, over 1,000 healthcare providers have died taking care of patients with COVID. 55% of that 1,000, the overwhelming majority, are physicians. Last March, you became a hero because you came to work to take care of your patients while being terrified you were going to do so. I know you were terrified because so was I, and we talked in the hallways and we whispered about how scared we were that we were going to die doing this. We never thought about not doing it, but we were really scared. Our spouses and partners, our parents and siblings, friends and family, even the in-laws that didn't like you that much, they were terrified that you were going to work at Elmhurst. Some of them begged us to take leave or quit. You know, we all remember reassuring our young children that mommy or daddy was not going to die, that we were going to come home, that we were different and we were special, not really believing in ourselves and not being sure that was what was going to happen, but that was what it was. So we buried that fear in what the psychiatrist would say is a very unhealthy way and showed up for our patients and our hospitals. Surgeons, not just the general surgeons and trauma, but ortho, urology, hand surgery, neurosurgery, oral surgery, you name it. It had surgery after its name. It became a criticalist in our surge ICUs. We dragged the anesthesia machines out of the OR and used them as vents. The ICU docs in hospitals ran everywhere in the hospital and put in tremendous hours. Floors became ICUs overnight. Renal's motto was, have kidney, we'll dialyze. ID oversaw the antibiotics of every single patient in the hospital. Peds ran around transporting unstable patients from ED to ICU. The psychiatrists manned family hotlines, giving updates. Pulmonary and rehab flipped patients back and forth like proning pancakes. IR interventional cardiologists manned the central line service. OB acted as family to the women who labored alone, devoid of partners or family. We manned testing tents and changed oxygen tanks and diapers in the ED. And the ED, my God, that was truly a battleground, as Dr. Bentley and others said. The chaos, the alarms, the life, the death, so much death. Residents took brutal 12-hour ICU shifts day in and out. Some abandoned their research work and actually came down to work and help out. And palliative care, the heart-wrenching work done by Dr. Castor and her team, allowing families to say final goodbyes through cell phones and iPads. The point is that we were all doctors, not acting in silos, but doing whatever was necessary in the height of the COVID-19 pandemic to care for our patients and to support each other. We were all doctors taking on any and all roles. And we must acknowledge the wonderful nurses, respiratory techs, x-ray techs, pharmacists, housekeeping, food service, material management, mortuary, and the list goes on and on and on of all of this silent, invisible staff that keep the hospital running for us during this time and all others. And we did this isolated from our loved ones, just like our patients, terrified of dying, just like our patients, devastated on the days when it felt like we could not save anyone from this virus. We experienced this horrific trauma daily, went home to a hotel or a cot in our office and came back the next day to do it again. The emotional and physical toll is something we continue to pay in weird moments of anxiety and fear that seem to come out of nowhere. The extra moment it takes us now to laugh or smile or find joy. I see you out there, the battered heroes of Elmhurst and the H&H hospitals, and I am very proud to call all of you my colleagues. Thank you. Mask up, vax up, kids.
That is why Doctors Council SCIU wants to take this opportunity to say thank you to each of you, seriously, from the bottom of my heart, for everything that you've done and everything that you continue to do. And you put patients and the communities first beyond yourselves. And I want each and every one of you to take this as an opportunity to give them a round of applause and to say thank you, doctors. Thank you.